Salt has a bad reputation. It's part of that white killer group, sitting somewhere between the white sugar and white flour. Salt frightens cardiologists, as half of people with hypertension are salt sensitive. Neurologists and psychiatrists also have beef with salt. And I don't mean bouillon or well-salted steak. I mean, they may not be happy about sodium effects on the nerves, because sodium excites them. Sodium can cause neuron overexcitement and lead to irritability and agitation. Too much salt can worsen tremors, twitches, and seizures. It's not all. Sodium can aggravate neuropsychiatric conditions including bipolar disorder, schizophrenia, and autism. Even dermatologists and gastroenterologists recently noticed that excess sodium may cause inflammation and aggravate eczema, psoriasis, inflammatory bowel disease, or leaky gut. Well, if salt is so bad, why would we even bother using it? Despite its bad reputation, salt is not something we can live without. Sodium is essential, and that means sodium cannot be made in our bodies and needs to be supplied daily, because our health relies on it. Sodium is not just for taste. It has a variety of functions that are vital to our well-being. Sodium maintains electrolyte balance, propagates nerve signals, and maintains body fluids. Salt is so important that without it, we can develop concerning symptoms and even stop functioning. I mean, completely. Too little sodium leads to fatigue. Unfortunately, many exhausted people don't realize that they could add extra salt to their diet and see if salt could give them an extra pep. For some people, it might be that simple. Yet the fear of sodium may be so unbearable that some people may not want to risk adding salt to their diet, even though sodium deficiency could be the reason exactly why they don't feel well. It doesn't matter that they also suffer from other low sodium symptoms, like irritability, headaches, confusion, or nausea. Most people don't have enough knowledge about benefits of sodium to connect their symptoms to lack of it. People with hypertension are especially in a conundrum. They are told to reduce salt to maintain their blood pressure. Unfortunately, that may not be the best advice for many. Only half of people with hypertension react to salt by spiking their blood pressure. For the other half, salt has no effect on the numbers. What's more, for quite a number of heart patients, salt reduction actually leads to worsening, not improving, of their blood pressure numbers. Yes, you heard that right. Low sodium diet can actually cause blood pressure spikes. Yikes! If you are a senior or have a senior parent, be especially on the lookout for low sodium symptoms. Studies found that low salt diets can do more harm than good in the elderly because they can worsen thinking abilities among older adults. Low sodium is frequently found in depression. Low salt and depressive moods are especially linked in women. Watch out for salt cravings. They may be your first signs of emotional downturn. Good thing is that adding sodium to the diet can change many symptoms in a rather short time. Studies showed that normalizing sodium may lead to elevated mood, more cheerful and energetic personality, lessening perception of stress, bolstering social interactions, and reducing compulsions. But don't think that sodium insufficiency can only happen to people who don't eat salt. It can happen to anyone, even you, a perfectly healthy specimen. There are two ways you can end up with sodium deficiency. Either by eating too little of it or by flushing too much of it. Did you know that PPE, known in medical circles as urinary output, is the main route for salt removal. And since salt follows water, the more urinary output, or PP, the more salt is lost. So anything that causes more pee causes also loss of salt. And that applies to common diuretics: pop, coffee, beer. Beer drinkers should especially be familiar with word potomania. This term refers to low sodium from excessive beer drinking. This is when beer belly and fatigue go together. Watch out for diuretics in a pill form. You may use them without suspecting that they may lower sodium. Among them are over-the-counter water pills, prescription drugs that stimulate kidneys, and natural or herbal detox formulas. And let's not forget the greatest diuretic of all, water itself. Yes, water is a diuretic, and drinking too much of it can cause sodium deficiency. And no, drinking water by the gallons is not a healthy practice, unless you sweat a lot. So what's the bottom line? Here are the points to remember. 1. You need salt. Don't be afraid of it. 2. Salt is essential, so use it, even if you have high blood pressure. 3. Watch out for salt deficiency symptoms like cramps or fatigue. Check your electrolytes, if in doubt. 4. To prevent salt overdose, ditch processed foods. Processed foods not only provide poor nutrition, but they also use massive amount of salt, even if they don't taste salty. 5. Cook at home. Learn how to properly use salt and spices to flavor your meals. Don't know how? If you have 2 left cooking hands, here's a must-have for you. 69 pleasures, 1 pot, no mess, and perfectly flavored meals without salt overdose. Enjoy your 5-star meals starting today. Oh, and don't forget to subscribe. Even more interesting things are coming in future videos. So, until then.